Hi, I'm Zach,
I'm Renee.
I'm Allison.
and we are Level 1 athletic training students here at Texas State University. And today, we'll be going over palpations of the lumbar region. I'll be palpating the posterior side of the iliac crest, lumbar spinous processes, sacral processes, and the PSIS.
And I'll be going over the ischial tuberosity, the greater trochanter, sciatic nerve, and the anterior portion of the iliac crest.
I'll be palpating the ASIS, the iliac tubercle, McBurney's point, and the femoral triangle.
So as you recall, I'll be going over the posterior side of the iliac crest, the lumbar spinous processes, sacral processes, and the PSIS. So we'll start over here in our skeleton model. Right here, we can find the iliac crest. And start at the top of the iliac crest, we're going to move medially towards the spine right here, and we'll be right in line with the L4, L5 interspace. So right below that interspace is L5, right above that interspace is L4, we can find L3, L2, and L1. If we go back down to L5 right here, we start this, right below that, we start the sacral processes. So right here is S1, S2, S3, S4, and S5. And right here is the PSIS, and that is the posterior superior iliac spine. And if we were to move medially from that point, it lies directly in line with S2, so I can help you find some of your sacral processes right there. So now we'll move over here, and right here, we can find that this is prominent on both sides, and you're gonna palpate along the curve to find the iliac crest. And so now we're gonna move medially, find that L4, L5 interspace to help us palpate those lumbar spinous processes right here. Find L4 and L5, and then L3 up here. And then if we come down here, we can find the PSIS. And if we move medially, we'll get that S2 right here, which will help us find our other sacral processes.
So as before, I'm going to find the ischial tuberosity, the greater trochanter, the sciatic nerve, and the anterior portion of the iliac crest. So on our model here, we have the ischial tuberosity right here, and the greater trochanter right here. And right in between the ischial tuberosity and the greater trochanter would lie your sciatic nerve. And then on the anterior portion, at the top, would be the iliac crest. And so on our patient, can you lie down for me? On your back. You're going to flex your knee. And then you're going to palpate to find the ischial tuberosity, the midline of the buttocks. And you should feel a bony prominence. Right there. And then to find the greater trochanter, you're going to palpate from the ischial tuberosity, palpate laterally, and then you can have your patient internally and externally rotate, and you should feel a bony prominence. And then to find the sciatic nerve, you come back and find that ischial tuberosity, and then you just palpate inward. And that's where your sciatic nerve should be. For some patients, they may feel a tingle. And then can you stand up for me? We're going to find the anterior portion of the iliac crest. So it should be prominent, but you still want to come in and palpate down. And it should be right there on top.
Okay, like I said before, I'll be palpating the ASIS, the iliac tubercle, McBurney's point, and the femoral triangle. So on the skeleton, your ASIS, which is your anterior superior iliac spine, it will be right here. If you go approximately 3 inches above the ASIS, you will find your iliac tubercle, which will be the widest part of your iliac crest. So for palpating on my patient, I'm going to ask them to lie supine on the table, so can you lie on your back? Okay, when palpating for the ASIS, if you go ahead and put your hands on the patient's waist and palpate for the bony prominence, that will be your ASIS. If you palpate approximately 3 inches above your ASIS, you will find your iliac tubercle. So for McBurney's point, one way to find it is if you palpate your ASIS, and then you can go ahead and put your thumb there. You can find your patient's umbilicus or belly button and put your pinky there. About 1/3 between that way, so about where your pointer finger is, that should be where your appendix is. And when palpating on your patient, if they have appendicitis, it will cause them pain. For the femoral triangle, I'm going to have the patient in Faber's position. So I'm going to have them flex their leg, abduct it, and then externally rotate. So the femoral triangle is defined superiorly by the inguinal crease, which has your inguinal ligament, which connects from your ASIS to your pubic tubercle. So it will be diagonal this way. It will be medially by your adductor longus muscle, which is right here. And then laterally by your sartorius, which is right in here. So running through this triangle is the femoral artery, the femoral nerve, and the femoral vein. So with your fingers on the inguinal ligament, if you drop laterally and inferiorly, you'll be able to palpate the lymph nodes that are in there as well as the femoral artery.